Hello friends, welcome back to my channel Dental Minibytes, Basics to Mastery about all dentistry related educational videos. So epidemiology is important topic in community dentistry and it has a definition which involves the distribution of the disease, or it is a physiological condition in human population and the factors affecting their distribution. So epidemiology is particularly related to a population rather than an individual thing. So, moving on to the principles of epidemiology, it is mostly concerned with the frequency and distribution of the disease and also the determinants of health. So, first one is the frequency of the disease. Frequency of the disease is nothing but it involves measurement of the disease and the quantification of the occurrence of the disease. So, it quantifies the disease existence in a particular population and which involves the measurement of the disease, that is frequency at which duration the disease has occurred. Then the next thing is the distribution of the disease. Distribution, this is the second principle and it is related to time, place and people. Time is nothing but whether the disease is increasing or decreasing over time, and when related to place, whether the disease is occurring in a particular area, that is factors affecting a disease contribution in a particular zone is provided by this place, and people who is getting the disease within a population, whether it is an adult population or it is an younger age group or it is an older population, that involves the distribution of the disease. So the distribution of disease mainly concerned with the time and the place where the disease is occurring and which age group is affecting with the disease. And the next important principle which involves the epidemiology includes determinants of the health. Whether consider whether the characteristic of the individuals with a particular disease is differing than those that of without the disease. That is, with the disease population, it identifies the characteristics of the individual in a disease population when comparing to the persons without disease. So, moving on to epidemiological reasoning, it has statistical association and causal association, which involves the cause and effect, and statistical association is interdependent with each other. That is, the etiology of the disease is related to its effect. Whereas in causal association, the cause is equal to that of effect. It is interrelated in causal association and it is independent of statistical association. So the cause and effect relationship should be first identified. Then an insight is provided by formulating a specific hypothesis. Then a research design is formulated, whether it is a randomized control trial or case study, cohort study like that. Then hypothesis should be tested. Then it goes on like identifying whether it is a statistical association or causal association. Then the final thing is uses of epidemiology. It is very important because we can remember it by the mnemonics human vary considerably, therefore people study epidemiology. Uses is very particularly related to assessing the healthcare needs, and the variation of the disease is also explained in epidemiological triad, and investigating the causal mechanisms, so preventive actions for a particular disease, and evaluating the effectiveness of health services. So these are all the uses of epidemiology and it can be identified with the mnemonics. So this is all about epidemiology, friends. So we'll see in the next video. Thank you.